If we don't reform Medicare, we lose Medicare. Let me repeat that. If we don't take steps to reform Medicare, we lose Medicare. If we don't restructure the program, more patients will lose the care that they desperately need. Mr. President, a very prominent figure, a leader of this country, made this statement. Almost all of the long-term deficit and debt that we face relates to the exploding costs of Medicare and Medicaid. Almost all of it, he said. That is the single biggest driver of our federal debt. And if we don't get control over that, we can't get control over our federal budget. That defines, in a very basic statement, exactly the challenge that's before us. It tells us, it gives us the warning that we need to heed, and it should spur us into action. Let me repeat that. Almost all of the long-term deficit and debt that we face relates to the exploding costs of Medicare and Medicaid. Almost all of it. That is the single biggest driver of our federal debt. And if we don't get control over that, we can't get control over our federal budget. That is a statement made by President Barack Obama. It's not made by a Republican. It's not made by an editorial piece in the Wall Street Journal. It's not made by a Tea Party leader or advocate. It's not made by any Republican. It is made by our current president. Our president has said we cannot sustain what we're doing and we have to get at it or it's going to take down our whole budget. Why in the world, having said that, and I think it's true, it's been backed by analysts that have looked at this whole situation, left, right, non-political, political, whatever, why are we here not going forward with addressing this very question? That's what the people sent us here to do in 2010. That's what they're asking us to do now, and yet we're acting as if this statement by the President of the United States has nothing to do with what we need to do, that we can simply ignore this and go forward and just cut a little here and cut a little there, but we can't touch the entitlement. We can't touch Medicare. Oh, papers